double cleanse. So I'll pop my gloves on. Skin's had a double cleanse, so just give a quick alcohol wipe. It's awful. Goes against everything, but I want it nice and clean. It's always good to have a look at the skin quickly after doing the alcohol wipe too, just to see if it has reacted from it, like if the skin is quite sensitive. So you can see with Bridget that she's fine. Always make sure that you're using fresh needles. Only one per person. So you can see it's got like a little rectangle shape, and then it's got a little rectangle shape in there.
Yeah.
So you can pop that in and spit across. So we'll start with about a 0.75. So you've got the dial here. So you can starts at 0. So you'll obviously learn when you're doing the course, like when to use all the needle lengths. So we'll start with a 0.75 for Bridget. If she's doing fine, I will go up to a 1.
So one's like the deepest.
2.5 is the deepest. I wouldn't ever use that on the face, but it is really good for if you're doing like stretch marks on the body.
Yeah.
Yeah, it's really good for that kind of thing. Alrighty, so we're ready to go. Are you warming up? Like, are you warm? Alrighty, so we're using the hyaluronic acid as the serum. I make sure that I don't actually touch the skin with this dropper.
Yeah.
Obviously right now her skin hasn't been opened up yet, so like it would be fine, but because as you go along, like the skin is opening up, so I think it's just really important to make sure that that dropper doesn't touch the skin. Alrighty, so we start with the forehead. So you don't want to press, you just want to glide. So my first pass is coming out. How's that feeling, Bridget?
Alright, but it's like weird. Not what you expected? No.
So it can feel like a bit, can feel a bit nasty in areas. So if you're like, well, for your first one, we'll just keep you at a 0.75. You look like you're already getting quite a good result from this already. So some clients,
It's like there, at the top.
I can make it shorter. If you'd like me to.
No pain, no gain.
The forehead is the worst because it's so bony. Yeah. I even find sometimes I'll need to do a 4th pass on the cheeks to actually get that really good erythema. Bridget's getting erythema like straight away. So much so that I probably won't do the 3rd pass. I'll just do 2 passes for Bridget. So it's really good to keep the slip as much as possible. So you can sort of see her skin's like sucked it up. Where we've gone, there's like no serum. Oh, is this your client already? process now will only be about another 5 minutes anyway. So it's away. So I've just popped a little bit more just to make sure we still have that good slip. So we're coming out. So you're just gliding gently across the surface. No pressure. Just like almost sitting on. Yeah. Because like with microdermabrasion,
Yeah.
you
Just
really
stretch
feel pressure.
out. Yeah.
So it's really the same sequence in that, like in the passes and the cross hatching, but you're using pressure micro. So she's got that raised mold there, so you just want to go around that.
That makes me want to sneeze. It's the top.
It's the really micro vibrations that do that.
I feel like it's not like a tattoo, like with bloody needles.
It is a bit, yeah. So I like to do the nose when I'm doing the sides.
Yeah.
So I'll sort of do the side and I'll come up and get this side of the nose. And then on this side I'll get this side of the nose. So this side. So don't be afraid to go to town with the product, with the serum. That slip's just really important. So you want to come down the neck a little bit. Alright. So we'll go down. How's that feel?
Yeah, it's fine.
You might find over the cheekbone you feel a little bit more again. You'll also find that you can sort of hold it. I mean, again, you're not using pressure, but you can have like a little bit of pressure when you're doing these fattier areas. So I'm just going to go up to that pimple just because it is open. And just around gently. And then come up and do the nose. You doing alright there?
Mm-hmm.
Alright, so we've gone down. So now we'll come out. If the client's skin, like if it's an older client and their skin isn't as firm as Bridget's, you would want to do a bit of that, like holding the skin taut. I sort of am out here, but that's all she needs. But for an older client with thinner skin, I would be holding a little bit more taut.
It's definitely not as bad as I thought.
The forehead's pretty nasty though, isn't it?
No, it's not too bad. Like, it's the worst out of all of it so far, but
So third pass do diagonal. I'm just using more lymphatic drainage as your direction. So you really want to get that really nice pink look. So she's responding beautifully. You do get little tiny blood spots, like you can see a couple on the forehead. Totally fine, totally normal. You'll know if you, as long as you don't use too much pressure, you'll be fine. you use too much pressure, you can get scratching.
Yeah.
But as long as you're just gliding, you're really just letting the skin kind of take you, if that makes sense. Just get the nose a little bit more. Sorry, it's a bit pitchy. Now, underneath the eye, you can also do some gentle circular motions. There's lots of treatments that you can't go that close to the eye. Skin needling's fantastic for that. I even come up and do a little bit underneath the brow here. Yeah, it's great to be able to do that because, yeah, so many treatments you have to avoid.
Yeah.
But with this one you can. Alright, facing up for me. I'm just going to do this little bit of the chin.
How's it feeling?
Not bad. I expected it to be like way less.
So I'll do this and then really I'm just going to be repeating on the other side so that you can go tooth comb.
I'm going in this room.
Oh, you're in this room?
It's pretty. And Grace has everything nice.
That's alright, you can do pregnancy in back room. The bed's left.
Yeah, but this one's better. And lighter.
Yeah, cool. Well, we
And
just,
she's like,
yeah, cool. Yeah, this one's wider, it's nicer. So we've done both ways. And then just do a diagonal out. Because I like to do the lymphatic drainage. I go out and then I start going out the other way on this side. I can see you tensing a little bit there, is that okay?
It's just like the
A
bone.
bit bitey. And I'll do this side of the lip when I'm doing this side. So just to the side for me. Alrighty, so I'm gonna start down. It's also really great that you can see, like you can essentially see
Yeah,
where
where
you've
you've
been
gone.
to. So anything raised, you want to go around, but anything flat, go to town. Don't worry about that sound, it's just the zero.
Sounds like Grace.
Alright, so third pass, do diagonally.
Beautiful.
Beautiful.
2 minutes to spare.
So dispose of this. It's all a bit slippery. So, just show the camera. The sharps. Pop it into the sharps. Alright, beautiful. So now we'll just do a cleanse, pop a cooling mask on,
Yeah.
and do the scalp massage whilst the cooling mask is on. When you hot towel that off, just make sure that your hot towel is quite cool.
Yeah.
Like give it a really good, nice air out.
Beautiful.